Hi, my name is Livia Kupker, and this is my presentation on schizophrenia. The history of schizophrenia, due to the nature of the disease, was quite rocky. Schizophrenia is a type of psychosis that is characterized by the disruptions in thought processes. Throughout history, there are cases of mental disturbances that are similar to the symptoms of schizophrenia, but they were attributed to spiritual or bodily imbalances, like demon possession or a imbalance within the spirit. So, people were often killed due to the idea that they were witches or heretics. Only until 1908, Eugene Bleuler coined the term schizophrenia, which means split mind. Today, schizophrenia is recognized as a complex brain disorder that affects cognition, behavior, and perception. Schizophrenia statistics: 1 in 300 people worldwide are affected by schizophrenia. 2/3 of these people do not receive specialized treatment. Men are more likely to be affected than women. Symptoms of this disease start in either late adolescence or early childhood. Those with the disease are much more likely to die early, and around 50% of people in a mental hospital are diagnosed with schizophrenia. In order to be diagnosed with schizophrenia, the DSM-5 has created a criteria that must be met. One or more major areas of life like work, home life, relationships, or self-care must be impaired for a significant amount of time from the start of the disturbance. Persistent signs of disturbance for 6 or more months. Other psychological diseases need to be ruled out before a firm diagnosis is made. And 2 or more of these must be present and must continue for at least a month. Delusions. This can be paranoia or a sense of power. Hallucinations. They may hear, see, or feel things that are not there. Disorganized speech, like jumbled words or ideas. Disorganized behavior, they dramatically shift from happy childlike behaviors to violent and agitated behaviors. Negative symptoms, they have lessened emotional expression, a lack of desire to care for themselves or isolate themselves. While schizophrenia is a neurological disease, there are physiological symptoms, which include neurological changes. MRIs have shown to seen an increase in gray matter in those who have developed schizophrenia. The frontal and temporal lobes are seen to have the most growth of gray matter. Inflammation in the brain and nervous tissue has been seen as a physiological symptom which leads to brain fog, loss of memory, depression, anxiety, and fatigue. Neurochemical balances such as low levels of dopamine, glutamate, and serotonin are common and cause certain symptoms of schizophrenia. Um, Oddly enough, those with schizophrenia have been seen to have or are more likely to get cardiovascular and metabolic diseases. Those diagnosed with schizophrenia are seen to develop hypertension, high cholesterol, and heart disease. This is due to a multitude of factors such as a change in lifestyle. They become more sedentary, they don't move as much, they don't get out of the house. Medications that cause weight gain, that's just a side effect of the medications, and other biological or genetic components. Immune and endocrine systems. It is not uncommon to see an overactive immune response due to high levels of inflammation. And hormones tend to be imbalanced, such as spiked cortisol, or the stress hormone, and altered thyroid functions. There is no cure for schizophrenia, but there are many treatment options, such as psychotherapy, which includes cognitive behavior therapy, which is a therapy that helps the patient recognize their own distorted thoughts and behaviors. After learning to recognize certain thoughts or behaviors, they are given tools to manage their own mind. Individual psychotherapy helps the patient recognize, build insight, cope, and emotionally regulate themselves. Family therapy is a learning and support tool for the family, which helps them learn how to handle situations while also receiving support for difficult moments. Psychosocial intervention includes social skills training, which helps the patient feel more confident in social settings and promotes independence. Support school or support employment is monitored school or work environments that allow for the patient to return to their normal routine before before they were diagnosed to keep the changes in their life to a minimum. Assertive community treatment is a team dedicated to treating the patient in a way that works the best for them. So nurses and doctors will come to them or go to a neutral location to where they can treat the best they can. Hospitalization and long term care. This allows for better management of medications, ensures safety of caregivers and patient, and it is around the clock care that does not rely on one person. Self care and lifestyle are major helping points for those with schizophrenia. Giving them a regular routine helps them build a life outside the illness. A healthy diet helps avoid other illnesses and worsening of symptoms. Exercise helps improve cognitive function and moods. Sleep hygiene, such as reduced screen time, no caffeine, and consistent sleep schedule. And then support groups makes the patient feel like they are not alone or isolated. Those living with schizophrenia have an altered perception. They see, hear, and feel things that others do not. It has been explained like a radio that is always playing and is not always playing nice things. They have disrupted thinking. Their thoughts are jumbled. For example, they know what they want to say, and then mid sentence the thought leaves. Emotional and social impact. Often, people with schizophrenia feel paranoid and mistrust, which makes relationships hard. They feel like they live in a different world that nobody else can see and nobody else can understand. They have moments of clarity, which is with the right support and treatments, people say that they have overcome their diagnosis and can still live fulfilling lives. For those who caretake, they tend to have an emotional, they have a wild emotional ride. They experience stress and burnout. Some feel like they are slowly mourning the loss of the person they once knew. And due to the stigma of schizophrenia, people tend to withdraw not only from the patient but the caregiver as well. Those who are caretaking for a patient with schizophrenia have to rapidly learn. They have to know symptoms, treatments, and crisis management for any time of day. Support is very important for those helping with a patient with schizophrenia. Many caregivers find solace and understanding from support groups that know what they are going through because they have the same experiences. Thank you for listening.